to the platform of the Swiss Liver Patients Association, Swiss HIPAA. Today's digital talk with the 10 questions and answer about liver cancer with Professor Peter Schemmer. Thank you very much and a warm welcome. Let's just start with the first question. What are the main risk factors for developing liver cancer?
I think it's a very emerging problem, the topic of liver cancer these days. And if you ask me the question, what are the main risk factors for the development of liver cancer? It's, well, at least in the past, it was a chronic infectious disease with viral hepatitis.
Okay.
I think nowadays we have overcome the more or less chronic infection of hepatitis B or C. Well, type A is not chronic anyways. But in the past, after this kind of infection, there was liver cirrhosis developing. And liver cirrhosis per se is a precancerosis.
Okay.
And no matter how the liver cirrhosis occurs, it is per se a precancerosis, and therefore it's a major risk factor for the development of liver cancer. Of course, you can easily develop liver cirrhosis with alcoholic liver disease.
Yeah.
First, if you consume lots of alcohol, the liver turns fatty, and after fatty liver disease, you will have emerging scar tissue in the liver with fibrosis, and then, later on it turns to be liver cirrhosis. And, of course, there's also alcoholic liver disease. And these days, because more and more people, of course, we all eat very well.
Yeah.
And, the eating behavior turns to be like, okay, there's lots of fat that we consume.
Okay.
And therefore, more and more obese patients are around. And I say patients because all of these human beings that are overweight are not very healthy. And then, these people have fatty liver disease, which also includes in some disease some inflammatory changes.
Okay.
And this indeed, turns into liver cirrhosis again.
Mhm.
And more people or patients become or develop diabetes.
Okay.
And with
So
diabetes,
same time as cirrhosis and diabetes.
right?
more or less.
And with diabetes, I think nowadays, diabetes is a higher risk factor to become fatty liver disease and then liver cirrhosis instead of having a chronic hepatitis B or C. So I
Okay.
think this turns to be now, even or in a few decades, the predominant risk factor for liver cirrhosis even. And then, of course, there are, general conditions, environmental factors, toxic things that you consume. For instance, if there's a painter, painting all day with all the toxins that you inhale, or even, some people drink funny things, and
Yes.
then this hurts the liver very much and turns into liver cirrhosis. And again, liver cirrhosis is per se a precancerosis, and then you will develop cancer at one day.
Okay.
And last but not least, in the past, many people have eaten, um, not very healthy food, because old food contaminated with mold
Yeah.
and aflatoxins. And this again is highly liver toxic, hurts the liver very much. And this also is an issue for developing the liver cancer. Again, when I stress the issue of liver cirrhosis, then I have to say you also can develop liver cancer in a non-cirrhotic liver.
Okay. This is
But
actually what I wanted to ask as well. If
yeah,
you don't have a cirrhosis, you can also develop it as well.
right. This is still possible, but it's more uncommon. It's rare.
Okay. It's very
So having I would say, healthy liver, more or less, doesn't exclude the possibility that you actually develop liver cancer, but it's more predominant
Okay.
in patients with cirrhotic liver disease.
So that's very, very interesting. I didn't know that cirrhosis is kind of a pre-stage of
It
cancer.
is. Right.
Okay, that's very interesting. What are the most common symptoms of liver cancer for the patient? What would you say?
Well, now it becomes very difficult because
Oh,
most of the time, there are no symptoms at all.
okay.
Uh,
Okay.
in later stages, you have symptoms because of the tumor growth.
Hmm.
If you develop a tumor within the liver,
Yeah.
then it expands the volume of the total liver, and therefore you get stress on the liver capsule from the inside.
Okay.
And the liver capsule is very, very well, there are many nerve fibers inside,
Hmm.
and this hurts. So if you have a pain in your right upper quadrant of the abdomen, then there's something going on in the liver. This must not necessarily be tumor growth, but this is very late time point where you actually have to have a close look what's going on with your liver. But again, most of the time, and this is the very complicated part of diagnosing liver
Yeah.
cancer in an early stage, there are no real um, symptoms. Later on, because I just said it's associated with the liver cirrhosis, you have all kinds of symptoms that are associated with the liver cirrhosis. And this is more or less weight loss. This can be because of the cirrhotic liver disease, but also because of a consuming disease, which is cancer.
Okay.
And also, weight loss and muscle loss. This is nicely associated with liver disease,
Hmm.
also is associated with the cancer. So there is no discrimination between what it actually is.
Yeah.
And in later stages, of course, you develop jaundice if a tumor compresses the biliary system within the liver. But again, this can be anything else. It must not be necessarily liver cancer or tumor growth. Swelling of the abdomen, developing ascites, and all this is more associated with the liver cirrhosis,
Mhm.
again, precancerosis,
Yeah.
but not necessarily a clear sign for developing liver cancer.
Okay.
It may be associated, but it's more like, a problem of the underlying liver disease than, a problem caused by the cancer that is developing most of the time much later.
Okay. Yeah, that's interesting because when you have a liver disease, you can have the same symptoms because of your liver disease or because of the cancer, kind
Right,
of.
right.
Okay. Yeah. So, but for example, if a patient is coming to see you and it could be that he has liver cancer, and what kind of tests are you running or what are you using for diagnosis?
I think this is more or less easy because
Okay.
uh, patients with liver problems
Yeah.
like fibrosis or cirrhosis
Yeah.
have to undergo a surveillance or a testing in some regard. And the testing usually is very simple. You start with with a very easy ultrasound.
Okay.
The problem with that is in a cirrhotic liver, you have so many nodules
Yeah.
that you cannot discriminate between, okay, this is cancer growth or this is a regenerative event in the liver. There are
Ah,
nodules that are caused by liver regeneration, uh, showing up like a tumor.
yeah.
So much more precise is than a CT scan or even better an MRI. And there are very specific contrast medias available, clearly identifying, okay, this is liver cancer and this is not. So this is very important. And today it's not necessary anymore to take a probe out of a nodule or out of a tumor.
You kind of a biopsy. You don't
No,
need.
right. So in the past, it was more or less frequently done,
Yeah.
And I would say even mandatory for the diagnosis of HCC, which is hepatocellular carcinoma. But nowadays, the diagnostic measures in in the radiographs, in the MRI specifically, are so precise
Yeah.
that a radiologist can, well, I shouldn't say easily say, but at a certain stage and size can precisely say, okay, this is cancer or this is not.
Yeah. Okay.
So therefore, MRI is highly recommended. Some institutions say and go with the guidelines. Okay, they do MRI plus CT scan. Uh, some even do ultrasound, but ultrasound with contrast media. This is
Ah,
even more precise than without contrast media. But gold standard, I would say, and we do it like this, is number one, MRI plus CT scan.
okay.
And well, there is another possibility to follow up liver patient once they developed cancer or underwent resection and so forth. There are tumor markers.
So you can see it in the blood as well. You want
Well, in some
tumor
cases, in
Okay.
some cases, you have there's a more or less specific tumor marker. This is called uh, alpha-fetoprotein.
Okay.
And this alpha-fetoprotein is associated with HCC growth or presence.
Mhm.
But if the AFP, the alpha-fetoprotein, is not increased,
Yeah.
this does not exclude cancer.
Okay.
If it's increased, then at a certain level of above 400,
Yeah.
uh, then it's even a guarantee that you must have the liver cancer.
Okay.
But if it's negative, it doesn't mean that you don't have liver cancer. So
Right.
this is a bit tricky,
It doesn't
uh,
show as
and
much.
therefore, yeah, therefore it's not good for the diagnosis.
Yeah.
It's good for follow-up. So if you have a patient with a AFP above 400, 500, then
Yeah.
he undergoes, therapy, and this will be another topic during our talk. And then, the AFP turns to be normal. But
Yeah.
then after a year or two, it decreases again. Then it's highly suspicious for, okay, there is recurrence of the cancer.
They came back. Yeah.
Right.
Okay. That's good. Good to know. Thank you. So there's also kind of different liver tumors. Yeah, kind a lot of difference apparently.
Right.
Uh, I've just heard like about the most common type, this HCC. Is there something else, or how you kind of can explain it to the patients? The
Yeah.
different, the
Well,
kind.
right now, we more or less talked just only about the hepatocellular carcinoma, briefly HCC, that's the abbreviation of that.
Yeah.
And this means that, this cancer develops originally from the liver cell, from
Ah.
the hepatocyte.
Yeah.
Once we talk about liver tumors, there's a whole variety of liver tumors. This is, primary uh, uh, liver cancers. This is HCC, but
Ah.
also CCC, which is
Yeah.
a cancer that is developing from the bile ducts. It's
Ah.
called cholangiocellular carcinoma. So this is derived from the cells that are creating the bile ducts.
Mhm.
This is a very rare entity, and well, the reasons for developing this is more or less genetic. There are also inflammatory liver diseases and other things, but this is more rare.
Okay.
Uh, then you have um, many different types of liver metastases.
Mm.
So these tumors go with the bloodstream, or these malignant cells come with the bloodstream to the liver
And stay.
and find an ideal spot to grow.
Yeah.
And these are cells from cancers that have been developing in the colon,
Mhm.
in the
Okay.
intestine,
Interesting.
or in any region of the abdomen. uh, gastric cancer, in all kinds of things. And then you can develop liver cancer, metastatic disease.
Mhm.
And if you talk about liver tumors, there are also benign tumors,
Ah,
which is
just small
non-cancer.
and it's not dangerous, kind of.
But,
Yeah.
well, I wouldn't say it's not dangerous, but it doesn't spread out, and
Okay.
it's not infiltrating. So the
Yeah.
two things, infiltration and being able to spread out, these are criteria for malignant tumor growth.
Yeah.
But there are other tumors that are developing inside the liver, for instance, adenomas, also derived from the hepatocytes, from the liver cells. And these adenomas are, at the beginning at least, benign. There are certain criteria uh, that influence their growth and also the possibility of turning into cancer.
Okay. They
So,
kind of can start not that badly and can turn into kind of dangerous.
right, right. And
Okay.
the possibility is different there's a whole variety of different adenoma types. Genetically, it's different in male, females, and so forth. So one has to probe actually the adenoma to be
Mhm.
sure what kind of adenoma you have. And then you have the likelihood whether it turns into cancer or not. And then you have to discuss with the patient, okay, better to take it out because likelihood is this and this. So
Okay.
it's not so easy. And then you have cystic formations,
Mhm.
which is, liquid inside the liver that is encircled by fibrotic
Yeah.
material or whatever. So
Mhm.
this could be an abscess,
Mhm.
inflammatory problem. This could
Mhm.
be more or less, I shouldn't say water, but liquid, clear liquid. And some of these problems are even that they are genetically derived
Ah,
and not necessarily something to treat.
okay.
And so also, other diseases that are rare, echinococcosis, for instance, yeah, there are treatment options. And so you have to distinguish between cancer and non-cancer disease. Some of the non-cancer diseases turn into cancer. So anyway, if you have some tumor inside the liver, you have to go to a specialist who actually can tell you, okay, what's going on and what kind of treatment options you have.
Mhm. Oh, that's good. You just tell me to go to the next question because I wanted to ask about this treatment
Yeah.
options which are available. Maybe just you could just talk about the most common or the one you are doing because you are also a surgeon. So yeah, it would be very
Well,
interesting.
nowadays, cutting out tissue is not only well, it's not the only option anymore.
Okay.
Most of time, and I stress also always the issue talking about modern liver surgery. Modern liver surgery doesn't mean necessarily that you only resect, cutting out the tumor,
Yeah.
but most of the time, specifically in metastatic liver disease, you have chemotherapy
Yeah.
before and after the resection.
Mhm.
Sometimes the resection is combined with, well, a method that more or less burns the tumor in the inside of the liver. Radio frequency ablation, this is one option. Cryotherapy, well, this is more or less something that was just pretty much in the past. And some, just putting heat in a specific place and then you destroy the tumor. This can be nicely combined with surgery or done without surgery. It depends on where the tumor is and how big it is and what kind of tumor it is.
You kind of can enter and destroy it.
Right, right.
Okay.
From the outside with a needle,
Yeah, within one.
via the skin, into the liver, even without an operation.
Great.
So this is an option,
Yeah.
specifically in HCC.
Okay.
This option is a good option in small tumors,
Mhm.
and today it's even a curative measure to
Mhm.
cure the tumor if the tumor, the HCC, is below 3 centimeter.
Okay.
Then we call it at least locally cured. Because again, it's not cured because most of time this tumor develops inside of a cirrhotic liver disease, and this is a precancerosis. So anytime a new tumor, a new cancer, a new HCC can develop anywhere.
Yeah.
Uh,
Okay. Anywhere after the treatment from one place.
right.
Okay.
Um, if the tumor is more superficial,
Mhm.
then this method uh, most of the time cannot be used because Um, the liver is surrounded from other organs, the colon, the diaphragm, whatever. And the heat that you apply to the liver is not only directed to the liver, but, surrounding to the whatever instrument you put in. And then the colon could be destroyed, and so this is not a good idea. Only small lesions inside the liver, well covered with normal liver tissue, can be addressed with the radiofrequency ablation.
Otherwise, you risk kind of hurting the other
Right.
organs with the surrounding.
Right.
Okay.
And if you cannot apply this ablation, then of course surgery can be placed. And surgery can be placed specifically if the tumor is bigger, because then the RFA is not curative anymore, but still can be used for palliation to shrink the tumor.
Okay. Yeah.
Yeah. And also talking about HCC, this is a very well vascularized tumor. So many, many vessels are going into the tumor from every side. And if you shut down the vessel supply, the blood supply to
Mhm.
the tumor dies.
Yeah, because it doesn't get nutrition, kind
Right.
of.
And if you do, an embolization of the
Yeah.
tumor, then most of the tumor will be destroyed. And this can be also combined with the ablation.
Okay.
Yeah. And then, if ablation is not a good idea, resection for whatever reason cannot be done because of tumor size, of where the tumor is in the liver, then there's still the option of removing the whole liver if it's cirrhotic, or if,
Mhm.
and do a transplant.
Okay. Or also a part. Or then in these cases, you kind of remove the whole.
Well, in this case, you have to remove all the liver. Be
Yeah.
sure before you do that there are no metastases anywhere.
Okay.
And there are in Europe, in many countries, certain restrictions for the indication of doing a liver transplantation for HCC tumor disease. So at a certain size, in some countries, it's even by law, it's forbidden to do a transplant because the outcome is not as good as if you have a smaller size of tumor.
Okay.
Okay, so, and if the tumor comes back very fast, then you have given a liver transplant to a patient who dies within short time, and this very same organ could have saved for another patient much longer time. So this is just because of the uh, shortness of having available transplants. Otherwise, of course, you could transplant anyone. It's the best palliation. In the past, it has been done like this.
Mhm.
But now we have an organ shortage,
Yeah.
and therefore we are urged to use the grafts, the transplants, for patients who have the longest lifespan with a graft.
Okay.
So this is an ethical thing for the population. Of course, for the individual who does not get the transplant, it's a disaster.
Exactly.
But then you still have the opportunity to have a living related liver transplantation because uh, a part of an healthy liver is good enough
Mhm.
to have a patient with liver disease surviving after transplantation. But there are also some restrictions because it's an operation for a human being who doesn't need the operation, the removal
Yeah,
part.
the donor, yeah.
And well, this has to be considered, of course.
Mhm.
And then at the end, there's another option. You can do radiation
Yeah.
for HCCs, but there are also restrictions, and healing is not accomplished by only radiation.
So it's kind of not strong enough.
Right. And then at the very end, there's an additional thing. This is chemotherapy. And you can, well, support the life of a patient who has the HCC, the cancer, but there's just there's a certain benefit for the lifespan,
Mhm.
which is not dramatic. So we are talking about just a few months.
Yeah.
And therefore, this is, sometimes combined with liver resection and so forth, or most of the time, for a palliation.
Mhm.
So, well, that's about it. For all kinds of other tumors, again, it's all this.
Yeah.
But most of the time, if you want to cure a patient, uh, the biggest thing is the resection. It's surgery.
Okay. Yeah.
So this is the major thing, and this is combined with either chemotherapy before and after surgery, plus minus the local ablation of tumors,
Okay.
for metastatic disease and for many other things as well.
Yeah. And so now, as a Swiss Liver Patients Association with a lot of liver patients or all, I'm just thinking, how does underlying liver disease, such as hepatitis or cirrhosis, or also an autoimmune liver disease, kind
Yeah.
of underlie this liver cancer? Is there more risk, or yeah, kind of?
Well, yes, it is because if you have a genetically driven liver disease, you most likely have developing liver cirrhosis at one stage. This is
If it's genetically.
right, right.
Yeah.
And if you have chronic inflammation, then this is also a major factor for developing cancer. Not necessarily HCC, the hepatocellular carcinoma, but CCC, the cholangiocellular carcinoma.
Yeah.
And this is more frequent in patients who have autoimmune liver disease, specifically in the area of the biliary system.
Yeah. So kind of the little roots in the liver.
Right, right, yeah.
Yeah.
And the diagnosis of this type of cancer is very difficult,
Yeah.
and most of the time even very late because you know it's so small, this type of cancer, that you, with the normal imaging, cannot detect it per se, just the
Mhm.
just the factors that are coming with it. So a stasis of the bile, for instance, this may be a sign for, okay, there's a passage problem, maybe
Mhm.
caused by a tumor, maybe caused by a stricture, scar tissue,
Mhm.
and then you have to watch out. Uh,
Yeah.
you have to have more specific diagnostic parameters for this.
Yeah.
Also tumor markers, but if you have inflammation, most of the tumor markers that are, increasing with CCC are also increasing with inflammation. So it's not very specific.
Okay.
Yeah. And once you have
Out of
cholestasis, then again, the tumor marker can even be increased without having cancer.
Okay, and
Yeah.
why so?
Well, because the marker is there in the body, it can be detected anyhow.
Okay,
And
because there is kind of inflammation.
yes, and this is then the marker is reacting.
That's why. Yeah. Yeah, because it's kind of also a damage to the liver, the
Right. Right.
inflammation, and is kind of a step closer to cirrhosis in a way.
Well, yeah, I wouldn't go so far, but inflammatory changes are, associated with markers, with proteins and yeah.
Yeah. Okay, that's very, very interesting. Thank you very much. Now, I just would like, because the time is really going fast, I would like just to ask one patient's question. And one patient asked what studies are currently being conducted on liver cancer.
Um, this is a good question.
Or what's going on at the moment in, yeah,
I mean, what scientists try very hardly is that there are three things. Number one, the early diagnosis
yeah.
of liver cancer. This is of utmost importance because the earlier you can detect cancer, the better the prognosis is, because at the early stage you can do much better treatment. So what can this be? Uh, There are certain markers in HCC, and this is, part of my previous research, even in my previous university hospital. And we developed markers that can detect HCC.
Hmm.
And with these markers, you can combine, uh, proteins that can be detected with a scanner.
Yeah. And then you can kind of
And
calculate the risk.
no, then you actually can see, okay, this tiny little something
Yeah.
is cancer, even
Oh,
though the normal X-rays, the MRI, doesn't detect anything. But this is, at the very beginning. But this is something that is hopefully developing faster every day, that we have earlier diagnosis. So this is number one. Number two is, and this is, more or less industry driven, but also some research groups are focusing on that, is getting better chemotherapeutics for liver cancer.
yeah.
Uh, this is not easy because there are cells that are just not responding to chemotherapy. So the option is to have these cells chemosensitized.
Hmm.
So there are drugs out there that are developed just to get the cells chemosensitized to have normal chemotherapy working. This is good for
Ah,
HCC,
yeah.
and for, for other tumors as well, CCC and so forth.
Hmm.
Uh, and then number three, of course, having better surgical approaches, or
Yeah.
better, local ablation approaches.
Hmm.
Um, there are many things going on, so I cannot specifically tell you, okay, there's a clinical
Yeah.
trial
Yeah.
there, and this and
Yeah.
this. So many research groups in the world focusing on this very problem, because, as I said before, we have in the future more and more diabetic patients
Yeah. Hmm.
with fatty liver disease turning into
Diabetic
cirrhosis.
2 type, this one.
Both
Oh,
type
both.
1, but more type 2.
Yeah.
And with that, you have a greater incidence of HCC. This happens. The other thing is metastatic liver disease. People are growing older, and then you have a colonic cancer. This is, metastasizing in about 70% of cases to the liver. And then
Okay.
you have to offer something to be curative. So this is a very big problem now, and becomes even a bigger problem in the future.
Mm. Yeah, and then it's also very difficult, kind of, because there's also a patient who asked, how will liver disease or other health conditions affect my treatment option? Like if someone is diabetic, then it's maybe more difficult to treat the liver cancer. Or if someone has a kidney
Yeah,
disease and
that's right. Because if the underlying liver disease is decreasing the liver function,
Mhm.
then, for me as a surgeon, then I cannot resect the same amount of the liver, like 60%,
Yeah.
because of the remnant liver
Mm.
doesn't provide enough function to,
To-
for the life.
Yeah. Yeah.
So this indeed is a problem. And also chemotherapy is toxic to normal liver per se. So one has to watch closely the liver function. If you have a patient with a liver disease with decreased liver function, and then you have to see what kind of doses you give, if it's still helpful at that dose, or it's just only toxic to the liver, and then then you have a problem. And so, yes, the underlying liver disease, diabetes, fatty liver disease, is a factor of giving restrictions for us doctors to either we can resect, we can ablate, we can put chemotherapy or not.
Yeah. And or in a reduced way or
Right,
in a
right.
different way. Yeah.
So, and then we come to a very modern topic. This is individualizing the therapy. And this, again, this belongs everything together. So if a patient has a problem with the liver, um, should really go to a specialist,
Mm.
knowing all these options. Otherwise, it is even more difficult.
Yeah. So sounds very complicated for us. So thank you very, very much for explaining all these topics and informations for us patients. And so it was our digital talk today, and we are happy to be here for you on www.swisshepa.org, and would be happy to inform you about further videos. Or you can also register for the next Swiss Liver Day on www.levertag.ch. We wish you a good time with the best possible health, and thank you very, very much for your knowledge. And have a
Well, thank you for having me with you. Thanks.
lovely. Thank you.